Bismillahirrahmanirrahim. So dear student, today we are going to talk about SA node, a pacemaker of the heart, and after this some other topics. Before this lecture we have discussed different aspects of the heart in how we discuss how impulse is transmitted from SA node to the different parts of the heart. Now it is important to know that SA node as a pacemaker of the heart. SA node, what is meant by pacemaker? Pacemaker mean that electrical activity is produced in the SA node. SA node is a pacemaker of the heart, which means that electrical impulse is produced in the SA node. This is SA node. Here electrical impulse is created, its self-excitation occur, and this impulse is transmitted to different parts of the heart. This is normally. Sometimes AV node and Purkinje fiber can also in these fibers and AV node also self-excitation occur. Okay, but it is important to know that self-excitatory stimulation rate of SA node is very high, and it is 70 to 80 normally. We say that 72, which result in heartbeat of 72 per minute. But the rate of AV node is second, and that of Purkinje fiber is third. AV node become excited, self-excited 40 to 60 times per minute, and Purkinje fiber becomes self-excited in range from 50 to 40 excitation occur per minute. Now note that this rate is very low, so low that if, for example, if one time excitation occur in heavy node or in Purkinje fiber, 2 time excitation occur in SA node. So let's consider here excitation takes place in the SA node. Now this excitation will cause the vector or impulse conduction. So the rate of excitation of AV node and Purkinje fiber is very low. Now here we discuss abnormal or ectopic pacemaker. These are especially AV node and Purkinje fibers as discussed above. Also sometimes atrial muscle fibers and ventricular muscle fibers. Sometimes in these muscle fiber it can also occur abnormal or ectopic pacemaker. AV node and Purkinje fiber are ectopic pacemaker. What is ectopic pacemaker? What is the definition? What is the concept of this pacemaker? Actually, normal pacemaker is SA node, but when excitation or work of pacemaker is done by other part as AV node or Purkinje fiber mainly, and sometimes atrial fiber or ventricular fibers, this actually cause abnormal contraction of the ventricles, and thus abnormality is created in the heart, and the blood is pumped not normally into the different parts of the body. So these pacemakers are called ectopic pacemaker. So we can say that pacemaker which is anywhere other than the SA node pacemaker, other than SA node is called ectopic pacemaker, and this is normally abnormal. It is normally abnormal. मतलब it means that ectopic pacemaker they are abnormal. ठीक है, they ectopic pacemakers are abnormal. Okay, abnormal mean that no regular contraction, that there is no regular contraction of ventricle when there is SA node, ectopic pacemaker. Mean that in case of ectopic pacemaker, not a regular contraction of the AV node occur. Sometimes let's consider when AV node blocks. When AV node blocks, sometimes AV node blocks. So what will be the result? This is AV node. It is the only path between the atria and ventricle where the conduction from SA node come into the ventricle. But sometimes AV node become blocked. So what actually occur? That there is no transmission of the impulse from SA node into the ventricles. So actually what happen? Purkinje fibers act as pacemaker in this case. So we can say that when AV node blocks, here Purkinje fibers act as pacemakers. Understand? Are you following? So Purkinje fiber act as pacemaker. Now we know that the excitatory rate of Purkinje fiber is low, 15 to 40 in this range, sometimes 15, sometimes 20, sometimes 30, and the maximum it is 40. This is very slow speed. Next, Actually, when AV node become blocks, when sudden blockage occur in the AV node, Purkinje fiber are in compressed state. They do not directly work, but it work after 5 to about 5 to 24 or 20 seconds. Let's consider when AV node blockage occur, Purkinje fiber do not suddenly start transmission or self-excitation and then transmission, but start this work after about 5 to 20 seconds. In this case, what actually happen when AV node blocks, Purkinje fiber cannot directly start its work, mean that it cannot cause the transmission of the impulse, and it start transmission after 5 to 20 seconds. So I can write here, when AV node block, Purkinje fibers start impulse conduction after 5 to 20 seconds. But actually there is a problem. Ventricle contraction do not occur in this time, and after 5 seconds after 5 seconds there is a condition which is abnormal, and that is fainting, and this fainting occur because of blood deficiency to the brain, and this condition is called stroke-Adams syndrome. Okay, you note that I'm here writing after 5 seconds, but after 5 seconds person heart activity is so depressed that person faints. Okay, person faints. Now actually this condition occur because of blood deficiency to brain. Brain is very sensitive to the blood deficiency, and this abnormal condition is known as stroke Adams syndrome. Okay, this is called stroke Adams syndrome, and if the period delay too much, it may cause death. Death may occur. If delay period is too long. Okay, so this is all about. Now I am repeating this lecture once again. Note that when AV node blockage occur, let this AV node, it is blocked. Now we know that when SA node, now what actually happen, the transmission from SA node will not pass through the AV node into the Purkinje fiber and then into the ventricular muscle fibers. So actually there will be no conduction of, no contraction of the ventricle. But here is another part of the heart, which is Purkinje fiber, which becomes self-excited, and transmission is created in or produced in Purkinje fiber and then transmitted to the ventricular fibers. But there is a problem. This is not working normally. Its speed is too low, 15 to 40 per minute, and another problem is that it does not suddenly start working after the blockage of AV node, but it takes 5 to 20 seconds. Let's, for example, when AV node become blocked, after 5 to 20 seconds, Purkinje fiber start transmission, creation of the transmission, and then creation of the impulse, and then transmission of the impulse to the ventricular fibers. So ventricle cannot contract and cannot pump the blood to different parts of the body, especially the brain is very sensitive. So after 5 seconds of the blockage of the AV node, a person become faint, and this condition is known as stroke Adams syndrome. If the period become too delay and the Purkinje fiber start work after too late, so it will also cause death. So death may occur in this situation, which is so it is very abnormal situation. So this is all about SA node is a pacemaker, and the other part that acts as a pacemaker. It is also important to note that atrial and ventricle also act as a pacemaker in some time. Here, you should also note that Purkinje fiber cause synchronous contraction of the ventricular muscle. As we know that speed of muscle conduction impulse to the Purkinje fiber is very high. So, approximately in a very short time, impulse is transmitted to different part of the ventricular muscles. So result is that all muscle is approximately contracted in a fraction of a second, very small time. So actually result is that contraction of the ventricular muscle or muscle fiber occur at the same time. So these are, let's for example 1 2 3 4 5 muscle. If let's for example the speed of muscle the speed of contraction of the impulse is slow, so this is for example inner surface of the earth, this is outer and outermost. Let's, as we know that impulse first is transmitted to the first inner part of the ventricle, then into the upper, so on. So in this way, let this is innermost surface of the earth, this is, and this is going outside. Now for example, let's consider there is a abnormal condition if the speed of impulse conduction to the ventricle is low. So what will happen? First these muscle fiber will contract, which are the internal, then these, and then so these. So it will have separate effect, and it will have separate effect. So the contraction will be not so much, and what will be the result? Result will be that the bulb will not properly pump into the body. But if speed of the impulse is very fast to the ventricle, then what will actually happen? If this internal muscle fiber is activated, this will also activate this is approximately in a fraction of a second, which is very small time. So what will actually happen, that all the muscle fiber of the ventricle will contract at the same time, and what will be the result? The union is strength. Okay, this will be a strong contraction, and the blood will be pumped in large amount at the same time into the body. As a result, blood, different tissue will receive good amount, optimum amount of the blood. So this is all about we discuss. If you really like our video, please subscribe our channel so that you may get best videos. Assalamu alaikum.